Today we're going to discuss falling. And as you can see here, it's a comical representation of someone falling on a banana peel. But in reality, with our residents, falling is a major problem, and we want to make sure that we are checking every possible way to help them. So there are many causes to falls. And most falls result from a complex interplay of predisposing and precipitating factors in the person's environment, as well as any risks of susceptibility to a medical problem or disease. So as they get older, it's not necessarily them being old that causes the problem, but it's any precipitation of these underlying causes or risks. As number of risk factors rise, so does the risk of falling. So many problems for falling are linked to physical or a mental problem and or a chronic, that's such as like a chronic disease. Other causes could be safety hazards in a resident's room. So we want to make sure that we're looking at every possible aspect and identify any modifiable risk factor to make sure that the resident is safe from falling. Some disease states that may be risk factors for falling are Parkinson's disease, dementia, depression, diabetes, arthritis, acute changes in condition, hypertension, delirium, overactive bladder, and anemia. And as you look at these, you can kind of gauge that most of your residents have at least one or more factors. So as the risk factors increase, then again, we also have the probability that falls may be a problem in this resident. Some other risk factors for falls that may include age. Again, as we get older, we start to lose muscle strength and we become weaker. Female gender, again, more likely to fall than the male. Low weight, history of falls in the previous year. Medications, any polypharmacy. Once you reach 4 medications per day, chances will increase that falls are definitely a risk. And as you can tell in most of your residents, some are up higher than 4. So we want to look at trying to reduce any possible medications that really aren't a good factor at this point. Disturbed vision. If their vision isn't doing well because of glaucoma or blurry, these too may cause problems. Gait disorders, inappropriate footwear. We want to make sure that they're wearing good shoes, socks, anything that's going to have good grip factor on the floor so that they won't slide. And again, muscle weakness, again, you'll see it more in the elderly, but you want to make sure if their muscles are weak, we want to try to get them to do some type of exercise to increase those muscles. Some environmental factors, again, we keep forgetting about stuff like this, and this is kind of important. So loose rugs or mats, if the floor is wet or slippery, especially around the bathroom area, because at night their vision isn't going to be the greatest, lighting isn't going to be the greatest. So if it's a wet floor, there may be an increased risk there. If furniture is in the way, sometimes they have to try to get around it. If they use a walker and they can't get around it, they may be more apt just to walk without it, which will increase that risk. Loose bed sheets and blankets. Usually if a blanket isn't on there secure enough, or if it's too long, as they get up, they might walk down the end, and if the blanket is on the floor, they may trip on it. So we want to make sure we can decrease any of these environmental factors as well. Medications may also increase the risk of falls. So we want to make sure that we're looking at any possible medication that has adverse effects and can cause some of these risk factors, such as drowsiness, dizziness, hypotension. Usually, if they stand up quick, sometimes on blood pressure medication, you may see that they get lightheaded, dizzy, and causes this hypotension. Parkinson's and vision disturbances are also something you may want to look at because they see more tremors and vision isn't good. They're more apt to miss something and trip over it. And so any medication that causes the following effects can increase the risk of serious outcomes if an individual falls. So you can increase osteoporosis, increase the risk of a fracture or fall or bleeding risk, increases the risk of a cerebral hemorrhage if a fall occurs. What are some of the ways to help decrease the risk of falls? Again, as there are many risks that increase, we can also look at possible ways to reduce it. Decrease the dose if possible and or the amount of medications that may be causing this problem. Check the dose based on age, weight, renal, and liver functions, which again, as a consultant pharmacist, we should be doing on a routine basis. The physician should consider the risk-benefit ratio of any medication to the fact that it's more of a risk than a benefit to use it. And is it possible to minimize the dose without losing the benefit of the drug? Some examples of medications that may increase the risk of falls, and again, I'm sure you've seen all these at some point with some residents, so you want to make sure you're covering yourself as well to look at all these factors when a fall does occur. And again, here's even more. And again, as we look at them, psychotropics too seem to be more of a problem that will add to any possibility risk of falling, especially when you're using benzodiazepines and sedative hypnotics. It's going to increase the risk of drowsiness, that morning after effect like you were drunk, dizziness, gait disturbances, and also any serious bleeding from falls will be a problem, especially when they're on warfarin or any medications that help to cause problems in that area, such as Xarelto, clopidogrel, Eliquis. And the psychotropics, again, are always a main factor: antidepressants, antipsychotics, sedative hypnotics, and anxiolytics. So you want to make sure, again, if they're using psychotropic meds such as an antidepressant, an antipsychotic, and an anti-anxiety, their risk of increased falls is going to be greater. So we want to make sure that all the meds they're on are most effective and that we can help with it. Some keynote of reference when you look at strategies to help prevent falls. We want to reduce the risk of resident harm resulting from falls and implement a fall reduction program. Identify residents at risk, communicating this risk factor to the staff, targeting interventions, and aimed at reducing the risk, and monitoring. So when the resident first comes in, first of all, we want to make sure that we are looking at any possible reasons for why they may fall, or if they have fallen in the past, and use what that worked in the past for them, or look at strategies to change anything that will help once they're in the nursing home. Fall risk factors and internal or health factors. Okay, if they've fallen once, they're going to fall again. Poor vision will increase that risk. Lower extremity dysfunction will be a problem. Unsteady gait. If they use a cane or a walker, it may also be a problem. Altered cognition. They're going to try to get up, walk around, especially if they have dementia. They're going to be wandering. The more they walk around at night, there's an increased risk. And again, the polypharmacy and medication side effects as well. External factors or environmental factors, toileting. Make sure they get to toilet prior to and after meals and whenever they need it. And also make sure there's good support, grab bars to get up, and equipment for support, especially if they're able to go to the bathroom on their own. Any extra furnishings that are in the room can be a hazard. Floors, loose or thick pile carpeting, sliding rugs, anything that can cause someone to trip or fall is a problem. Poor lighting at night, we have the lights out, so there's an increased risk at that point. Assistive devices, bed rails, rather than preventing falls, bed rails increase the risk of serious injury, so it's better not to use them and is kind of looked down on unless there's adequate documentation. Any clutter in rooms or hallways is going to increase the factors as well. Behavioral factors. Certain residents' activities or decisions may increase the risk of falls, such as walking around in stocking feet that are more slippery than if they had something, a shoe to help stop them from sliding, rushing to the bathroom at night, exhibiting unsafe behavior. If they're overestimating their ability, as you're young, you feel good, you can move and do things a lot easier. As you get older, you still may think you can do those same things, and a lot of times we can't. Situational factors. A lot of times it's due to acute diseases or change in condition. And as they get elderly population, you'll see a lot more problems with UTIs, pneumonia, dehydration. So you want to make sure that we're taking every care possible to help them not get these conditions, or if something does happen, we're catching it quickly. Persistent pain, it limits the mobility, so there's an increased risk of falls. Some of the fall scales to determining risks. Now, there's a lot of assessment tools that are out there and are available for fall assessment. Some of the commonly used risk assessment tools will include the Morse Fall Scale, the Johns Hopkins Fall Risk Assessment Tool, Hendricks 2 Fall Risk Model, and St. Thomas Risk Assessment Tool in falling elderly inpatients. So these are some of the things that you can do. It kind of tells you what to do and where to look. Also below, we do have a lot of references for that you can look up on the website. Some information the interdisciplinary team can utilize to help reduce falls. Primary prevention. This means taking measures to prevent the falls in the people who have not fallen, and some of these examples could be increased exercise and physical activity to the point where they're able to do that. Any activity that you see movement and muscle and exercise is going to help them keep the muscle strength so they're able to move more freely. Always review medications routinely. Any changes may cause a problem, so we want to make sure that the adverse effects of, say, a new medication, increase in medication, or an add-on medication aren't going to increase the risk factors. Some examples of different things you could be looking at. Blood pressure medication. Make sure the blood pressures are monitored routinely while on this therapy so that we're not getting a lot of fluctuations or we're not seeing a lot of low blood pressures and causing problems. Visual disturbance, especially if they can't see well. So you always want to make sure that anybody that has cataracts, poor depth perception, or glaucoma, wearing multifocal glasses while walking can also lead to falls. So we should make sure that if they're wearing the glasses, we're covering that end and making sure they can see quickly, moving from one focal to the other. Usually, if they're split bifocals, that's always a problem. And cataracts or glaucoma. As we get older, the more our medicines we use for glaucoma can also increase factors. And it's hard when you're elderly to see clearly between dark and light, especially when they first come in. They're not familiar with the surroundings. So make sure that everybody is safe. You walk them around, let them know their surroundings, and let them get used to that. Confusion, even for a short while, can lead to falls. If you wake up in an unfamiliar environment, you might feel insecure or unsure of where you are. So make sure the resident feels that they're safe, especially if they are confused. Wait for their mind to clear up and teach them to use a call alarm or to help have someone come and help them to get up and walk around. Again, the more medications we use will increase the risk of falls. You want to try to get regular exercise if it's possible. Any form of exercise will help with balance. A lot of nursing homes now are using Tai Chi programs. They feel that that's very good for balance. Any exercises that work with leg strength and improve balance will work. Make sure you're getting their eyes checked at least once a year and update their eyeglasses for maximum vision. Make sure the area around the resident's room is safe by reducing any trip hazards. Check for dehydration by labs, intake or outtake, and their skin. And some situational factors. If they're new admission or post-fall, if they need the toilet, make sure they are getting toileted. Even if they just went to the bathroom with urinary incontinence, they may feel that their bladder emptied, they get back in bed, and it feels like it's full again. So we have to remind ourselves that we're dealing with older residents, and it's not just the way we would feel. Secondary prevention. This means taking measures to prevent further falls. So if they've had one fall, especially with injury, they may be more apt to fall again. So we want to make sure that we're covering every aspect and looking to help so that we can prevent any further falls. Education and information giving. Compliance is best achieved by involving residents in decision making about their care and finding out how much change they are prepared to make to help prevent the falls. Information should be available in languages other than English. Information, both oral and written if possible, should be given to the residents, especially if they're deemed competent, and they should include some of the following: the measures that they can use to help prevent further falls, the importance of persevering with falls prevention strategies, physical and psychological benefits of modifying fall risk, sources of further information on how to sum up or help in the event of a fall. So the more knowledge that the resident gets will help to understand why they need these prevention measures. Scope of prevention can be appreciated by considering some of the common conditions, risk factors predisposed to falls in the elderly, and then make sure that we are doing everything possible to control these factors. And again, here are some references, some websites with different information about falls. Some may be the same, but it gives the nursing staff and administration time to review some of them and see if there's anything worth helping to help reduce the facts that there may be other information out there that we can use to help prevent. So by documenting, we can then understand what needs to be done and take action accordingly and help the resident in any way possible. So you want to make sure when you care plan the fall risks and interventions that you have for it, that the staff can then review those, and we should be reviewing them on a care plan every 3 months, every 6 months, or whatever you feel the best. But as long as we're covering these avenues, we can then make sure to help the resident in any means possible to stop further falls, or at least help to prevent further falling. These are cases that we need to address because there can be harm in a fall, and we want to make sure we're seeing anything that we can to help prevent those. If you can see something ahead of time, we may be able to help prevent it. So in conclusion, make sure we're documenting and we're reviewing and recare planning anything necessary to help in these matters. Thank you.